obviously we are here providing essential need in relation to equipment, and we would only normally raise one chair. So it depends, it's different for people who've got dementia who are not able to know which chair to sit in. But if somebody is able to, we would only usually raise one chair, and that's their main chair in their, say, living room. We wouldn't raise a chair in their dining room as well. If they want to actually privately do that, then they can, and again we would give them advice on that. So here we are in the toilet, one of the most frequented places of occupational therapy. Getting up off a toilet is very similar to the chair, and usually I would have measured the client's leg length before coming into here. And also, so while you're doing the assessment and the client is sitting in their chair, I would have actually measured their leg length, and I will know whether or not they're going to be able to get out of here. Because if they can't get out of a chair at a certain height and the toilet is the same, they're not going to be able to manage here. It's often useful, what you need to do is to actually look and see before you do anything. So you need to know where the waste stack is on the toilet. You need to see whether or not there's anything obstructing the toilet that will impede if you need to fit equipment. You also need to be considering health and safety, and I would say you always need to wear gloves when you're dealing with something like the toilet. The thing that I always expect is that you would actually see the person get on and off the toilet, and this is a very intimate thing. So you do a dry run. I have known some clients remove their clothing, but you must explain to them that you don't want to see that. What you're wanting them to do is to sit on the toilet and show you how they actually get up. There's nothing like seeing what they're doing. You'll often see marks on the wall, dirty marks on the wall where they're actually holding onto the wall, or they might hold onto the basin. The actual toilet itself, the seat, etc., is an important thing to measure. So what you're measuring is the floor to the toilet seat. Now, bearing in mind, the seat is hard, unlike a chair. But if you were going to consider a raise, the raise goes on to the ceramic bowl. So you need to actually measure without the toilet seat, and then the difference between the client's leg length and the ceramic bowl will be the raise that they will need. But before that, sometimes the height is fine. There's nothing wrong with the height, but they need something just to give them that extra boost. And normally we would think about something like a toilet frame. Obviously, when using a toilet frame, the person needs to be able to put hands equal pressure on both sides of the frame to be able to stand up. They also, as regarding the chair transfer, is they need to move forward and up. Somebody who's had a stroke, for instance, or somebody that doesn't understand about the equal pressure could do this or this, and they would fall on the floor. So you may want to consider floor fixing the toilet frame so that doesn't happen. Obviously the client will need to give you permission for that, and also you need to be thinking about the fact that you are sort of putting something through their bathroom floor. But you need to talk to them about that, because sometimes a floor-fixed toilet frame is all somebody needs. You also need to be considering other people in the family, in the house. It could be that somebody of a wide width, for instance, another family member, wouldn't be able to manage the toilet frame. It's perfectly okay if this can be moved out the way and stored somewhere. But if you are floor fixing it, it can't be. So you really do need to consider other family members, who's going to be using it, and if you're going to store this, where would they store it? Can it be put somewhere safe so somebody can't be hurt? What you might need to provide is a raised toilet seat with a toilet frame as well. This actually helps give somebody balance. This combination is often very good. Obviously, my feet are way off the floor. You must remember that when we were doing the chair, I advised that you wouldn't raise the chair higher than the person's leg length. With the toilet, because they're not sitting, or one would hope they're not sitting on the toilet for a number of hours, you can raise it a little bit higher, but again, you would need their feet firmly on the floor still. You must remember that people have got poor muscle tone, and where you yourself could actually manage to get off the toilet this height, somebody with poor muscle tone will actually end up on the floor. So you need to be considering that. But I would not normally raise the toilet if somebody couldn't put their feet firmly on the floor. So this combination is quite good, but we can also provide something called a Mowbray toilet frame. So this is a Mowbray toilet frame. It goes over the toilet. So this is a raised toilet seat plus a frame. The added advantage is that if somebody has got a stroke or there is a danger of tipping, this is a little bit more sturdier because they're using their weight. So if I use one hand, for instance, I can stand up. And if I use one hand again, I can sit down. But that again, we're talking about risk assessment. You need to assess the risk. If somebody's got a stroke and you're helping them with the toilet, you then need to actually think, well, should this be floor fixed, or am I happy with that? I would encourage you to actually consider risk, and also sometimes it's worth the risk. But that's you as a practitioner, you're the only person that actually will be able to know. We do sometimes do rails on the wall, but I would suggest at the moment that for rails we would need to actually do, refer to the intake team for the moment. But for basic kit like a frame and a raised toilet seat, this provides somebody for a safe transfer off the toilet. Obviously, when you're leaving a piece of equipment, you need, and particularly in relation to the toilet area, you need to be talking to somebody about the fitting of the equipment and also the cleaning of it. If somebody else is going to be using the toilet and they don't want this, you need to consider where it's to be stored and also how it's to be cleaned. And if that person can actually position it in the right place again. Cleaning would generally be with your normal cleaning materials, or soap and water is a very good cleaner. Okay.